Hello everyone, I hope you all are doing well. We are going to start today with Suturing Part 1 lab. This will be in 3 separate PowerPoints. So where are we going? Part 1 will cover the basic principles and simple interrupted sutures. Part 2 will cover anesthesia and vertical mattress sutures, and Part 3 will cover incision and drainage. Goals of suturing. Main goals are to stop bleeding, prevent infection, preserve function, and restore appearance. Considerations. Some considerations to think about are type of suture, what material to use, the type of suture needle, and the size of suture thread. Type of sutures. So there's absorbable and non-absorbable. Absorbable, the material will break down and is absorbed by the body. These do not need to be removed. Some examples are chromic gut, PDS, and Vicryl. There's various indications for these. Non-absorbable are used for skin and also for permanent internal placement. If used on the skin, they will need to be removed. They have greater tensile strength. Some examples are silk, nylon, and proline. Some types of suture needles are taper, which is blunt or rounded tip, useful in less dense tissue that requires small holes and minimal tissue injury, such as bowel and fascia. Cutting or reverse. These have a sharp tip with a cutting edge along the side of the needle. They're useful in more dense tissue. Creates more tissue injury though, and they're commonly used on skin. Curved, there's different diameters based on size and location of the wound. And then straight or keep are used for long, straight incisions or wounds. So here's a picture of a tapered needle and a reverse cutting needle. And then these are some pictures of curved needles with their different diameters, as well as straight or Keith needles. Suturing sizing. It's based on a numbering system and it includes 2 digits. They're commonly expressed as 20, 30, 40, and so on. Most common sizes used in the emergency department are 40, 50, and 60 for the skin. The larger the first number, the smaller the suture in terms of its diameter. The larger, heavier suture material, such as 0 and 20, is more commonly used for denser, stronger tissues such as fascia, ligament, or tendon repairs. And then this is just some examples of different sutures and their suture sizes.